Next, the other common question is, we have done all the investigations, our tubes have been told to be normal, they are open, eggs are forming. Eggs are forming on the follicular study scans, tubes are normal, my husband's test is normal, then what is the reason? See, at this stage, when we say it is eggs, it is not actually eggs, it is the follicle. When we see on scan, we cannot see the egg by naked eye or through a scan. It has to be an IVF where eggs are taken out completely. So the common question asked is, my follicular studies have been normal, I am ovulating, my husband's test is normal, my tubes are checked by HSG, it is also normal, then everything else is fine. So why am I not conceiving? So in those cases, at that level, when we mean that egg is normal, when you say that egg is normal, this egg can never be seen on the scan. These are not the eggs what we see in follicular study. These are the follicles. In this follicle, there will be a small microscopic egg which cannot be seen by naked eye or on the scan. Let it be any machine, 2D, 3D, 4D, whatever the common question asked is, in bigger machine can we see? No, it cannot be seen. This is the follicle which we see, and we assume that the egg is good when the follicle is good, when the blood flow is good, when the lining is good. So we assume that follicle is having a good egg, and then we'll give injection for rupture and we'll plan either a timed intercourse or an IUI. So the pregnancy success depends on the quality of egg also at this level, which we don't see. The other thing is, HSG is usually considered as the initial step in checking the tubes. HSG is an X-ray where we send a dye through the uterus and it has to come out through these tubes and fall here. At that time, X-ray is taken from above to see whether the dye is going. So if the dye is going, that means the tubes are patent, tubes are open. But that doesn't show us whether the tube is closer to the ovary or away from the ovary. In many cases where there are previous infections, previous tuberculosis of the abdomen, or any previous surgeries, endometriosis, where there are adhesions, ovary will be here and the tube may be at a distance, where we assume that follicle is ruptured and the egg should go into the tube. But because of the adhesions, the tube may be open, but the egg may not be going into the tube. That itself may be a main hindrance, where people keep thinking that, okay, it is fine, egg is fine, tube is fine. So it is not so. At this level, we can tell only this much. So next level, when you're not conceiving with this good follicular study, good HSG and good semen analysis, next step is to check whether these two are nearby or not, and your lining of uterus is good or not. So how do you check that? It is only by laparoscopy.